Good afternoon, everyone, and welcome to Beyond the Headlines. Today, we take a closer look at the stories that shapes our communities and our future, going past the surface and into the impact and the context and the conversations that matter.
In every episode, we move past what's trending and examine what the headlines truly mean for everyday Filipinos.
I'm Mildred Galarpe.
And I'm DJ Moises.
Okay, DJ, today our conversation will focus on the healthcare system in Cebu Province, a vital issue that impacts not only community well-being, but also economic growth and the overall quality of life.
And to share her insights on the province healthcare system, its impact on communities, and the ongoing efforts to ensure accessible and quality healthcare services for all Cebuanos, we have the PISO health consultant of the Cebu Provincial Government, Dr. Elisse Nicole Catalan.
Good afternoon, Doc.
Afternoon, Ma'am Mildred, Sir DJ.
Good afternoon.
Nindot atong Monday, no? Kaya para sa atong guest, karong adlaw niya. Nindot kay iyang Filipiniana, DJ. Dili common.
Actually, it's we've been talking before airtime, no, na it's good that Filipiniana is now being brought mainstream, that it can be worn on everyday
Yes.
interactions.
Especially every Monday. Kay flag ceremony. Anyway, before we go in detail sa healthcare program, we wanted to know who is Dr. Elisse Catalan? Like, are you practicing in the country before you joined?
So I'm hello to everyone listening. I prefer to be called Nikki. It's easier to be
Nikki,
called.
okay.
Elisse Nicole is such an 80s kid's name, diba? Na two names. So Nikki, I'm comfortable with Nikki. I am a nurse and a physician by profession. So I'm both. I'm licensed in both. I also after completing my medical school here in Cebu Doc, I did my internship in Philippine General Hospital. And then I took the boards, and then shortly after I went to the States to learn public health. So I did my master's in public health at ICANN School of Medicine at Mount Sinai, and I also did a master's in healthcare management at Johns Hopkins University. And a bit further, I did healthcare leadership also in Harvard Medical School. So beyond that, also dili ra ko ka ng US, but I also I did work in CCMC when I was a clerk. We were very much exposed to the rural communities, and also when I was in PGH, my gosh, we were such a small batch. Now you'd have to go on duties 36 hours every other day.
36, that's more than
Yeah,
one day.
and it's really we've been exposed to that. They also give us rural and urban exposure. So I was also put in Cavite for a while. We did rural medicine there as well. So even before moving overseas and having global exposure, I've been pretty much exposed to the local healthcare landscape here also.
Doc, while a lot of healthcare professionals, particularly doctors, they tend to gravitate, no, towards
Global, overseas.
global, no, or kanang thriving outside the country. What moved you for you to decide to stay or to come back in the Philippines?
Yeah. So I find nothing wrong with having to seek specialization or learning abroad. There's nothing. I think it's a good thing about our generation. We have the capability, and there's avenues to go overseas. And the young students, when I see them in youth forums, I say you really find a way to learn more. It's a good way to learn from other places as well. But for my end, I was gone since I completed studies here. My professional career was fully overseas, but I was always home. I was home almost every other month. When I was in the US, every other month I would come home. When I was in Singapore, I was home almost every weekend.
Because
So-
it's shorter.
A shorter flight,
time.
just 3 hours, and I've always loved being home. Family was here. Family has always been here. My mom's pretty nationalistic. She could have been elsewhere, but Cebu na siya. And that's why. And what really brought me back was family. And I think that would echo with the other healthcare professionals as well. I mean, you can go outside, but their heart always comes back here.
Because of family. You know, good na, if only opportunities are better here in our country,
Yes.
who wants to go out and leave your family?
Precisely.
Diba? But you're forced to, just like other overseas Filipino workers, we're really forced to go out to seek for a better life for their
And to
families.
provide
Yes.
better.
Yeah.
To provide better, tinuod gina siya. So, muna, karon Dok, kay you're kinda in a position or naa ka sa lugar nga ang imong nakatunan all those masters in public health in the US sa Philippine setting. Can you give us a short assessment of the health system when you join Capital?
So I would say there are pockets of excellence in the urban hospital. So the pockets of excellence I refer to, we have really good hospitals here, tertiary care hospitals. But the problem is in the rural, atong provincial hospitals, they're really fragile and broken. WHO has this term called inverse care law. So those who need healthcare the most actually get access to it the least. So that's really when I got in. That's really the setting that I saw. Beyond political assessment or anything, 200, we really saw dilapidated hospitals and systems that didn't work. So that was very heartbreaking to see, especially coming from a very idealistic, very well-run hospitals that I worked with in New York and in Singapore.
Kana siya sa mga hospitals, is it kakuwang sa funding or walay action ang hospital authorities in the provinces?
So it's an amalgamation
Okay.
of many things at once. It's policy, it's governance, it's the budget that's there, it's the people also who's not empowered. So multifactorial kina. It's mo na ang cost niya.
Okay.
Given the situation in our hospitals, Doc Ba, how many doctors and healthcare professionals do we need to fill the gap?
I'd say a lot.
Yeah, there is the current, pila ang current. Yeah, number one is how many hospitals do we have?
So okay.
Yeah, pila ang current, pila ang ideal.
So currently the province, the Cebu province, owns and runs 16 hospitals. So 2 of which are level 2, Bugo and Balamban. You have 4 level 1 hospitals and then 10 infirmaries. And then each of these hospitals have different manpower requirements based on the DOH. And just getting back to your question of how much we lack, no? So I had HR give me the numbers. For plantilla lang, it doesn't even include the JO positions. There's 85% that's unfilled. That's quite a lot. And then if we are to improve our hospitals and upgrade them from infirmary to level 1 and level 1 to level 2, mas dako pa sad ang need to fill that gap.
Okay.
Okay, there was already an identified need, no? What do you think was the one causing for them not to be filled?
So I would say in 2 administrations ago, there was already a system in place. I think Gov. Junjun had placed very good people that was well manned, and apparently the administration after, there was really a gap there and a lack of priority. So there's
So wala siya na fill. Ni-end ang contracts, then wala na siya na fill up or wag gid siya gi-fill
Wala
up.
siya na
Wag gid
fill
siya
up.
allocation to start with.
it's funded but it's not filled.
Oh, okay.
Kaya identified naman ang roles.
O, diba? Kay
Yeah.
plantilla positions na good
Oh,
siya.
Correct.
And also, the DOH has very strict guidelines, not guidelines even, requirements of how many manpower should there be for specific beds and for the size of hospitals. So, na-adyo na siya daan.
Okay. You said there are 16 hospitals. 2 level 2, upat ka level 1, and 4 infirmaries.
10
10 infirmaries. Unsay, what is the infirmaries for? Unsay makaya buhaton sa usa ka infirmary?
So, they're very basic. Kana lang, basic consultation diagnostics, inpatient na for very mga fairly less severe na diseases. I wanted to step back. I wanted to share po the jurisdiction of the Cebu province are only the sub-apex hospitals. This is what you call kani atong 16 hospitals. The apex hospitals, which are your Vicente Soto, your St. Anthony's, your Eversley, are under the DOH. Your RHUs, your rural health units, are under the LGU directly. So policy, manpower, and budget sa Cebu province kanira dun atong 16.
16 hospitals. 16 hospitals for how many towns?
50 municipalities, you mean?
51.
51 municipalities,
Okay.
yeah.
So kung for example, naaka og Argao, in that area, asa man ang...
So that's why the CPH Karkar is very critical. More dun na atong biggest in the south. So a lot of the controversies and the are in Karkar because they receive about 23 to 24 municipalities ilang gi-cater
Sa
din na-
south.
Yes.
Okay. Well, ang pinakadako na to is Karkar, but nabay laing hospitals in the south aside Karkar?
They're the atong infirmaries na aman, but they
Okay.
can only handle as much. Like I give you an example for kanang pregnant women no, and deliveries. Ang infirmaries cannot take care of kuan ni siya of gravida kanang buntis between kung first time pa di sila handle and beyond 4 gravida 4 di sila handle by right they have to refer
To the bigger hospital?
Yes.
Okay.
Kay they're considered high risk. So if
Yes.
high risk kay, it has to be a higher tier hospital. That's why our leveling up is very important because if our infirmaries can be level 1s and they're capable of handling more cases and in the health financing wise they can also get back more sa ilang PhilHealth shares, which in our first week of office we had a very good briefing by both DOH and
And PhilHealth.
PhilHealth, and they were telling us grabe among claims there are a lot of denied claims and we also got the list of the diagnoses that they can take care of, and they're very kuan kaayo kanang minimal ra kay ilang ma-take care of bitaw. So it's one of the things really we're
So, kung if these hospitals and infirmaries ma-upgrade, so that means ma-decongest ang
yes.
Soto.
Yes. And also, there's really the urgent katumanggod karon what's very glaring is the need for curative which is the hospitals. We haven't even talked about preventive and how to stop people to get to the hospitals first, but ang pinaka pressing need is to make sure our hospitals are stocked and well manned and we can manage these cases. So kana hopefully when we really work towards that na we can handle cases na so ang maabot na lang sa Apex are the more complex ones.
Yes. Mga surgeries nga unsa na kanang open
Mga
heart
valvular,
surgeries.
mga yeah.
Oo.
Given it looks like there's so many things that need to be done. No?
Yes.
So what are your priorities as
Bitaw,
of
asay una.
this time?
Yes.
Given
Nagdagan kaayo from
daghan kayo.
manpower to supplies and equipment.
Yeah.
So I keep talking to internally with our group mura manig kana galing kanang yarn bitaw na you have to look asa ka
Asa ang sakto. Asa man ang end ug asa ang start ini.
So that's really on our
Untangling gud siya.
Yes, untangling, that's a perfect word. So that's why naglisod jud mi na where do we start, because it's all pressing, and you know what's the problem with healthcare, lives mo good at risk. If you delay anything, it's someone's mom, it's someone's dad na we don't want to lose ba. So anyway, what the priorities are, so as mentioned, curative and preventive are both, there's different levels of care, but right now the most pressing is curative, and to make sure na we stabilize the operations in our hospital. And then I keep talking to the media and ko na think of our needs as the Maslow's hierarchy of needs in the big triangle. Pinakaubos should is the medication, equipment, supplies, filling the manpower, also the infrastructure, because the infrastructure is key in upgrading and what's needed bitaw there. Okay? If we went around the hospitals, not all, but majority of it, there's really dilapidated ceilings and non-functioning bathrooms, and you have x-rays na X-ray rooms without X-ray since 1993. So
Ang
these
sili siya room ra.
Oh, Rimra. So going back to that Maslow's hierarchy of needs kind of structure, so infrastructure, then that's where we can think of digitalization and data capture, because that's also from my training and also from my work experience, data-driven decisions are really
Yes.
important.
Especially now.
Yes, and especially in the political landscape we're in, you have to be very evidence-based and very surgical in what you need and how to get how to lobby your said your needs.
Okay. I like the pyramid.
The
Yes,
Maslow.
The
I think it's
Maslow.
easier to
It's
communicate
easier.
now. Yeah.
So because I've heard some updates on the second kanang part
manpower.
now, which is the
Yes.
manpower. But can we backtrack on the base? Where are we? At least I
In
know it's
supplies
just
and
less
yes.
than 100 no days.
Oh,
but
so-
where are we at least on the base? No?
Executive Order number 1 was actually emergency, allowing the giving money for emergency purchase of medications to really stock our hospitals. Okay, it's very basic. You need to have IV fluids. You need to have your medications there. So we've filled that gap so far, and also further than that, the MOEs. So they weren't. I don't want to delve too much on that, but we made sure that the supplies were given to our chief of hospitals, so they can disperse and they can do whatever needs to be done there. And also, going back to the medication and supplies, we do need a better inventory management system, because the forecasting of this and the
Yes.
delivery is such a headache. And you can imagine for islands like Camotes and Bantayan, when you bring medications, it takes effort and it takes logistical planning.
Yeah, knowing how long government
Yes.
process request, by the time libita when man ka
Ang
mo start
cycle,
og
turnaround.
request 50% sa
Yes.
imuhang
Yes.
or kay sus dili
turnaround
dali
time.
mag-request ko karon wagi siguro by December pa mo abot kay
Yeah.
magbidding tedious kayo ang
Yes.
process. It has to be tinuod na dok ang kanang yung inventory sa imuhang supplies kay
And forecasting po,
Yes.
considering the lead time.
mo na importante ang imong data
Data-driven
ng capture
approach.
nimo kay makitaan man nimo. Remember si Pag-asa 30 years of his history, so makita nila ang forecast, makita nimo nga inani nga season ting
Yes.
LBM,
Yes.
inani nga season ting uwan, so makita gid ba di bisag I think without data ron karong panahon bisag unsa ka nga sector you'll be blind. You'll be hitting hit and miss gid ka. So you said na 85% is unfilled sa
Of the
karon
plantilla
of the
positions.
plantilla positions.
This doesn't
lang,
even include the
JOs. Sa karon sa 85% pila na atong na-fill.
We're still ongoing hiring pa.
So,
So
sukol do?
daghan.
Okay, daghan.
So the issue we're having now is just to streamline the process. Kaya the previous process magud took a bit of ping pong between two departments, and we're hoping to fast track that. Kay the energy, the enthusiasm is there. Now we want to help, and we don't want
The momentum is still there.
So we
might as
don't
well
want to
use it.
lose that, and we also want to kind of encourage more bitaw, and especially filling the vital medical specialists. There are different tiers man of doctors. So you have your medical officers, you have your specialists, and the specialists na magugay required per level of hospital. You need to have OB, you have the pediatrician, imong surgeons, and especially knowing where our kanang cases are usually. So kinahanglan mo fill sa nato.
It's good no na kanang that area is being kanang given focus. Pero katong going back to the first question earlier ba na kanang it's also good that there's momentum. Pero in terms of sustaining the
Yes.
momentum dok ba, considering again that medical professionals especially, tend to gravitate towards working abroad.
Yes.
Do we also have kanang action steps or programs
To keep them. Longer.
Yes.
to sustain
Yes.
this?
So we're really looking into incentivizing them. So I can share this part. They took out the incentives. PhilHealth, SSS, Pag-ibig previously for the JOs. So we're working on reinstating that back now. And apart from other possible incentives, like I can share
Tepa, wait. PhilHealth and unsa tong
SSS
Pag-ibig.
Pag-ibig.
So these wala ni siya before. Gitangtang
natangtang siya. Wala siya na-continue for the JOs.
for the JOs.
So we're working on reinstating that, which takes some
Yes, ang
effort.
government lagi, no? Kay mo yung number one violator, labor law violator, di ba, no? Oh, abot, sorry, Doc. No, but really, kanang, even the JOs, or even the kanang contracts, gano'n, but sa private sector, stick to
6
kay
months.
ka. On the 6th month, whether irregular kag di, automatic na ka-regular niya. Bisag, dili pa ka-regular, you already have the basic SSS, pag-ibig, tax, ang tax, good. So kana siya, Doc. So what for JOs ni, so now inyong ibalik.
We're working on that.
Okay.
It's one of the things we're looking at. And also like the PRDPs, the Post-Residency Deployment Program. So we get them from the UH. We also, GovPAM also signed to give them allowance
Okay.
to help them with transport. So kanang these small things add up to big things, mga God. And even when I do my visits in the hospitals, I always ask, Doc, asa inyong quarters?
Yes.
What does the quarters look like? Eh, that's the only comfort you have while you're working 24, 48
Yeah,
hours.
especially if assigned ka in Karkar,
Very
but
far, yes.
nagpuyo ka sa Mandaue, no?
Yeah.
Murag, ang quarters yung importante.
Precisely. And I lived in quarters. Mura dyan na imong home o comfort ba. So, I do look for that. And then, all those incentives. I don't want to overpromise also.
Yes,
so that's why I
you
don't want to
should-
share too
should
much. Oh, but we're really looking into that. Kaya ako mismo trabahan tisag ko kaya ko how it is in public hospitals. So we're working towards that. But with regards to the speed of it, I think people, some have been quite impatient, but that's what we keep asking na kuan lang, pasensya lang kay give us a bit of time.
So medical equipment, supplies, and then staffing, and then I think this is
Yeah, the
infrastructure.
infra.
What's the rest of the
The
pyramid?
rest are all the programmatic things and the
okay.
data and the digitalization we can put in.
Okay.
Even as far as going solar for the hospitals, can I said it's a dream.
Tinood na siya. Kaya I think, especially in the province, no, nga kanang wala naman kay enough space for
Yes.
for solar niya. Needed gud na niya. Cost man gud pud na og padayono na nimo kay ang kuryente.
Init,
cost mo.
especially during summer.
Oh, I forgot to mention the health financing. So that's also one part that we really need to work on. The claims and how to maximize your PhilHealth programs.
Tinuod kay
kanang
iba
imong
ang
yakap.
promise is zero
balance
billing.
bill, yeah. So and we're very lucky because the DOH, PhilHealth, they're all very supportive. So I've met with them at least many times in the past 2 months. We're chatmates already. So and also we were able to harness different government and private sectors, and they're very. That's why people see me bitaw and say, "Oh, consultant." Ako, actually, I'm just the face. There are so many people behind me, and a lot of these private citizens and professionals, they'd rather not be. They don't want to be bashed or seen, bitaw, but they really give sound feedback and also. How to help us bitaw. So that's there. I'm just the note taker. I'd like to think I'm a note taker and bridge.
Yeah. Pero the way makadungog ko ba kay marabag ka nang okay picture nimo ang kahimtang sa hospitals in the province. Sa pag-interview na to sa PDRMO the last time, ningon siya, starting September, mag-lease na ta og sea ambulance. How important is sea ambulance for
It's
Cebu?
very, I think before we started, I was saying a very heartbreaking joke I heard when I was in Camotes was if the doctor can do anything, the next prescription was Jumalia, which was shipping to go across. It's really sad, especially for neuro and cardiac cases. There's urgency, man, good in
time.
time is of
budget,
the essence, and these places are tourist places as well, and people live there. May unta na atong kuan rin na siya.
Do we have a
right away.
hospital there?
Yes,
o
we do.
mulabang pa?
There's a hospital in Camotes.
In Camotes.
It's actually level 1.
So level 1 can accommodate
It can accommodate ang mga basic obstetrics. They can do some surgery, basic, and then inpatient, some inpatient na
asa ang hospital located?
Pilar, if I'm not mistaken.
Okay. So tinuod na siya, no, kung madala dayon siya
It will be
diri.
faster.
Faster, pero ang ato na sa daan na ang pag-insure na pod nga ang ambulance di pod ma-abuse.
Yes. And the ambulances, I wanted to share, there's really a nuanced issue about that because in a municipality, there are different ambulances. Maingay ka ambulance, kinsay tag-iya sa ambulansya ang munisipyo ba, ang katong
Ang
LGU
LGU?
or ang hospital na provincial hospital. Kaya sometimes yung ambulansya. So what we did also, what GovPAM did in our first week of office was increase the gas allowance
Yeah.
because it was previously decreased. So she increased it to at least 300 liters per ambulance. Actually, we're still studying that if it's sufficient, but not for the islands and the farther. So it has to be proportional as well. So that's also very key for the mobility and
Kung
the
saan man
immediate
mo
transport.
ambulansya niya, di mo dagan, kay mo tubil pa, yuway driver. So
kana
unod
siya.
na.
So that's why I wanted to be very clear about it. It's such a nuanced information, no, but where the ambulance comes from. But kani naama good per local health board in the LGUs na sila who is the first can say first responder.
Yeah. But for ambulance, sinuod na, kinsa may huwa sa say, kung patan, kinahanglan ko og tabang sa ambulansya, kinsa man ang naisay nga, okay, respond.
Go or no go?
So it's the local health boards actually are the ones who have na sila ilang own na kini munisipyo first or last line na ang provincial hospital na ambulance mo di na siya mo differ. Which also brings me why the provincial health board is so important because it oversees all of it. Of which was inactive for 6 years.
Okay.
And the provincial health board is key in policy and budget, and it's in support of the universal health care.
Kaya bitaw, Doc, I think, sa karon nga panahon, integration na magid siya, no? Kanang
Yes.
para pareho ang tanan ninyo nga ano. But there are towns nga naa siya season gud nga na from every year naa gid siya kanang outbreaks of diarrhea, outbreaks of kanang tungod sa dili maayo ang tubig.
Yes.
Ang health board ang mo tan-aw.
It's one of the things that they can also look into, investigate, and recommend to the chief executive.
Kay murag kung every year na, that means you're not doing anything about the
Yes.
problem. Kay recurring man siya.
And this is also why data surveillance is very important, and it brings you back to the data as well. So before coming last week, I was with DOH Region 7, and they were telling us, oh, we have to up our what's this for dengue. We're expected a spike in September. This September.
Okay.
And I would like to correct myself. The hospital in Comotes is not in Pilar. It's in San Francisco.
Okay. San Francisco. Thank you, EJ.
And it's also good earlier that you mentioned no about kanang collaboration with DOH and other agencies. Can you elaborate more how the collaboration is right now?
Yes, so it's very very congenial, not more than congenial. It's very collaborative. We see them very regularly. The lines are very open, and if there's programs that they want us to look into, and actually, they may do with the promise. Dr. Brillantes and his team, the RLED team, Dr. Padindol, they promised on day 2 that we will give you a assessment of all the hospitals, and they delivered in between 2 to 2.5 weeks, and really got the list of deficiencies, not just manpower, but also with equipment and the physical plan. So they really gave us a good
Baseline.
na this is what you're working with, and this is what you need to procure and to fill in.
Okay.
That's good, no? Because even with the limitations of data, there is still an attempt, no,
Yes.
to really make the assessment accurate.
And PhilHealth as well has been very active in helping us. We've had several meetings with them in the capital, and also bridging the gap between the chief of hospitals and the municipal health officers, and rolling out the YACA programs and everything. So it's I would say very, very positive in that collaboration and with the government.
Remote locations I have a soft spot also for them, no? And you've mentioned that what they have as of this time are largely infirmaries.
Yes.
With the infrastructure, Doc Ba, is that part of at least the priority for the next 3 years? I'm not saying
Yes.
for the first 100 days to upgrade the infirmaries.
Definitely, because you have people there, and it's very hard to. That's what I mentioned earlier, that the inverse care law.
Correct.
The people who need the most get the healthcare least. So that's a priority. Now we really give care and faster, faster, kinder care. To them.
Nindot na, faster, kinder care. So, kind
Faster,
na siya.
faster, closer.
Closer,
I was looking for the right word. Closer, faster,
faster,
kinder na care.
Okay. So, kana siya do, kanang, with all these problems, kay bao mangyuta nga, dili sad inana kadaghan atong resources.
Yes.
Especially nga, nag-ubos pa gani atong budget proposal karon. Asa dapit sa, I don't know if you're aware, but for the budget proposal, asa dapit ang healthcare.
Well, it's definitely a top priority. So this was it was a promise, and then we will definitely make do with that promise. And I on my way here, I was reminded by our administrator na there is 650 million that will be allocated for all these infrastructure changes.
Infrastructure meaning the hospital buildings.
The actual structures itself.
Oh, so gikan sa supplies, ilan ang ginahinag address, manpower,
Your infrastructure.
And then infrastructure.
Oh, I'm happy it's catching on.
Yeah.
Yes.
Because I
So,
also
sunod, ato na din ta sa data. So,
and the health financing and
yes.
everything.
Nindot ang kanang since evidence-based man gyud pud ang health system, mas magyud bitaw ang magklaro gyud ang collection sa data. So we'll find out unsa nga mga klase nga sakit ang ni ano sa mga taga Cebu. Kay there was a PhilHealth na report nga ang mga claims dili gani mga cancer, mga kuan,
It's
but
very basic.
basic lang ang mga
So,
sakit. Ubuhilana, something in ana.
yes.
So, but I'm sure there's a lot of people nga namatay aning mga ano nga sakit. What happened? Wa kaabot og hospital?
Wala nakaabot. It's the problem with the access also. So I can affirm what you said now when PhilHealth gave us the list of top diagnoses, mostly lang were gastroenteritis, community-acquired pneumonia, mura jud siya ang ilang
Mura if katong data imong makita, so that means healthy ang mga Cebuano. So what happened to di ba ni-increase good ang funds, ang coverage for cancer, for breast cancer, for unsa pa na din na ni-increase, but nobody is availing kanang.
Yes. And I also would like to bring it to an intangible thing that is trust.
Yeah.
So we also have to rebuild the trust, to regain the trust of people na we're trustworthy, na di mo mamatay ikabot nimo sa provincial hospital, or if you happen to be in a resort somewhere and something happens to you, then you're okay, or you're swimming in the whale sharks in Oslo, and our provincial hospital can take care of you as well. So that's
Yeah, I think it's very karon ba kanang if we are promoting tourism, there should ang accessories ba for
Yes.
it to be sustainable is actually health.
Yes.
Correct.
Diba?
Especially for emergencies.
Yes.
Na stroke ka kay init kayo wala ka adjust or na kanang nakatamakag tuyom.
So that was why it was quite outrageous to me na when I visited Oslo, there was no ECG machine even. So that to me was very kala. But anyway, that's being procured now, and we should have that in a week. I don't know, several weeks. Depends on how the
Pero
process
basig,
is. But
sure gyud ta nga by Pasko na
na sure na jud.
Sure na ginawa yung Pasko na.
But I also, just to go back to data, no, we have the PhilHealth data saying kani tourist destination, mga minor lacerations o kanang mao na ilang naabtan dito.
So I like the idea on the pyramid. I also like the idea about curative and preventive. I think much of the conversation today is on the curative.
Curative.
No? Can you also help us see
Yeah.
The
what's the
preventive.
preventive programs also that are in the provincial government's priorities this time?
So this also goes back to what I mentioned earlier about itong sub-apex and your municipal health officers, which are under the LGUs. So we don't control their budget and policies, but we can influence though. And we really want to put effort also in basic good hypertension, diabetes, kanang mga chronic illnesses bitaw, for their monitoring and medication compliance. And going as far, we also have worked on mental health. So there's a long tawag sa Panglawom has been there for 10 years, but we wanted to amplify their voice and say there's a suicide protection, kanina side. So there's so many things na baya, but we just have to harness, put them together, and to amplify kanina mga programs and in the preventive side para ato sang ma-decongest ato ang mga hospitals.
It's true. Kanang sa unang nga panahon, may gikag mental health. Mental health good. Kanang murag, it's because resilient man good ang mga Pilipino. But I think after COVID, kanang di na nakita nga, it's true. There is such a thing as mental health. Katulang na realize ba because there's already a lot of people who experience it. Di lang mga schizo, but kanang yung ordinary people nga because of you're being enclosed for so long, in ana siya. Then pressure sa work. Grabe naman ang pressure sa work karon, especially for those working remote kay wa mo kay kasturya. Lisod ba?
Very
Unlike
isolated.
na aka sa office setting, pwede ka mo to sa imong HR, but it's difficult kung mag-chat lang ka. But yeah, it's true. Ang kanang sana kanang sa paglaom sa Soto man na siya,
Yes,
Dok, no?
at DOH and Soto.
DOH and Soto kana siya nga service na ana every time na naatay istorya sa Sunstar about kanang suicide, we always put sa tumoy nga naani nga service so that ang mga tao makabasa ba kay maybe dili ganahan mo adtong doctor but kanang kastorya lang.
So that is one aspect of it, and then other preventive health programs. And I would also like to acknowledge our private sectors. So a lot of the hospitals have come forth and say, we have charity clinics. You can bring your provincial patients, too, and a lot of private doctors also offering support and finding ways to help us.
The missions recently are also in partnership with private hospitals, no?
And I always want to say about these missions, they're really stopgap solutions. My dream in life, one of my dreams in life, is we don't have to do missions.
Missions anymore.
They're just, kung sa Bisaya pa lang, pampaapas, labito ni sila. They're kay alibyo lang ni kanang
Or
apas.
interim
100
solutions.
Yes. And we're very blessed that these surgeons, these surgeons cost a lot of, they're really expensive. They're top-notch surgeons, but they're doing these procedures for free. So personally, the least I can do is put them a snack bar and have them food and just being with them during these missions, kanina weekends.
Now, talking of mission, timing nga aning Proud Bisaya. Si Proud Bisaya 85 rin siya. Maayong buntag, Dok. Naapa mo libre surgical mission. Akong tiya nakalibre taon. Salamat kaayo. Pero ako, wa ko kaapil kay trabaho. Pwede pa, Dok. Asa man kadapita Proud Bisaya. Kay para makibaw ka when ang next nga mission, apas na lang ka dinto. Let us know kung asa kadapit.
So I'm very happy naka-avail imuhang tiya. So the next immediate, we did a marathon. It was really a marathon
For the whole
every
month
weekend.
of August,
yes.
no?
So it was different hospitals. So it was Sui Generis and Cebu Doc in the first weekend. The following was Chongwa and UC Med. The sunod was Amro with Perpetual Socor, and then the last weekend was with Soto. The next one would be in Bantayan.
So,
Mid-September.
Katong mga doctors to ato nga
From
hospitals, nga nangadto sa probinsya.
Yes.
For free.
For
and,
free.
And the reason being, I also wanted to be clear about that, na we used the 4 provincial hospitals, kaya they're the bigger ones, man good. Dili na siya Balwarte High or Paburay, but it's just they were better equipped immediately na mabutangan na mug staff, the equipments and everything, and we can bring the doctor safely there. There's big enough space for them, but the subsequent ones will be a bit more spaced out. So the next one will be in Bantayan, but we're working on smaller missions na more targeted ones na maybe cataracts lang for now or the small excision. So pang-apas scheduled din siya. That
For
works
now-
concurrently with all the reform.
Like, for now, kanang
Interim solution.
nga sa katong labaw nga katong
Nang labaw o
immediate ang need na ba kay dugay na nasakit, so the missions is there nga in
To intervene.
but gina eventually ato gid ta sa hospital, di ba? It's the hospitals yun.
yeah. And it's also our way of making the doctors and surgeons comfortable na, in your free weekends, you can probably come here also do surgeries na mo na.
Kana siya, Dok, kanang pag-sud mo sa Kapitolyo niya, you and the governor were really kanang carrying the banner for healthcare. How was the response of the private sector on the healthcare sector?
overwhelmingly good, to a point na I would cry, makahilak ko. Sometimes nung meeting, I would catch and look at these people, and these are people I admire. These are people na marag, what? You're talking to me? And I'm like, I'm theory, I now just remembering ko, grabe, they're stalwarts in their kuan bitaw, and then they're doing these surgeries for free. These are time away. They can easily do
On a weekend.
Yes, on a weekend. And when Jesus nagpakaba na in town, and you don't, the behind the scenes bitaw, these people, they do mag-map na ni sila in between kay just to turn over bitaw of patients. Kay imagine, like, we would do, what, 20 plus a day or more in a day?
Surgery.
So, paspas kay na, tapad na, and then man ko, uy, nang map naman ni si Doc. kay they really want to the output but taas. So it's very positive, and I think it's also a reaction to how they were shunned and shamed previously, and medical community that they did not forget, and they were here to say we're 100 all out support, and also they na doctors become doctors for a reason. There's really a part of them big part of them that really wants to help others ba. So naadyo na.
Bitaw. Pangutan na good, mag-unsa kay dako nimo, mag-doctor nganuman kay ganahan ko manambal. Mo magina siya ang mindset, di ba? Nganong kay ganahan ko inana. So along the way things change. But it's not maayo ba nga ang
It's still
private
there.
sector nga mga doctors naapa na sa ila.
Yes, naadyo sila, and we really want to recognize them. I think people also some look at it and say, oh sige, mag-post ani and shoot. Actually, it's really to recognize the heroism and the volunteerism there. Na people should know that these kwasus, they're really banding together and helping fellow Cebuanos. So, admirable kayo.
So for the last 2 months na, Doc, no? So this one, I hope, this is intended to be a light question, no? Pero what has been the most challenging, and then we'll end with the most rewarding so far on working as a consultant, no, at the provincial government?
The most challenging, I think, take out the noise and everything. That's there. It's to communicate what you're trying to do and to tell people na just give us a little bit of time. Things don't happen overnight, and while some might want you to fail, we really want this to work because lives are at stake. We're not here dili ni pagwapa pakuan. When you go, if people want to go with me to the hospital, I really welcome them. Please do, because you see humanity in the eyes, and how people really need help. So ako, I do this from kinasingkasi ni ako. I mean, it's a professional sacrifice on my end, but which brings me to what's rewarding when you see patients going home sooner, and then they tag you in post bitaw na nakauli na akong nanay.
Salamat.
I had 3 hours of sleep, but I don't care. I'm so happy about that. So that keeps me going, and I think that makes for a very good life if we can really make do with that, and even outside bit of politics. I mean, we've been in the NGO sector before that, so I find a high from that.
So kana siya, Doc. Looking ahead, what major reforms or projects under Governor Baricuatro's administration do you think will have the most lasting impact on Cebu?
I wanted to add one thing. My being consultant is no signatory, no salary, so kana I wanted to put it out there.
Kanindot din na.
I wanted to put it out there
Before
first.
answering atong question, unsa man unsa ang imong responsibility as a consultant?
So again, no signatory, no salary, but I do form. I give my my recommendations directly, and I still work through the public health office and all the necessary na mga department heads and kuan. So we don't bypass that or anything. So I'm quite respectful of the structure that's already there.
How's your relationship with the provincial health officer?
we have to work in beefing that up and having it more resilient and more prepared for all the reforms now we plan to do. So kind of it's a I would say in a short word, work in progress.
Okay. So balik na ka atong
Oh, with regards to the reform, so I wanted to make sure na the lasting impact, the overarching goal really is no Cebuano left behind, and how we get to that are several ways. We stabilize hospital operations. We make sure manpower is there. We follow the Maslow, the hierarchy.
Maybe you should name it na good daw.
Yes, I mean maybe some branding person
Correct.
can help
Oh.
us. I'm open to suggestions. We have hospitality people telling me, "Uy, we'll help you. Cause sige, when due time when we fix bitaw the small things, I can get the hospitality people to help us as well. Maybe next year." Okay, in the U.S. it's a trend, healthcare and hospitality, because you also have to show kanang kuan bitaw some kindness and some kuan to patients na
tinuod na kay ngano na ay nag-message na mo kanang among WhatsApp do kanang kuan na siya nag-uwa na siya pero may reklamo kanang nangagtabang always. In fact katong recently the Azela property owners nga 100 home buyers until now 5 years na wala pa sa balay dito sa Tugikan, but there's this patient from Karkar mo lang na siya, they asked not to be named, mahadlok siguro ba kanang this happened in Karkar nga ang iyahang pasabot is na hospital ang tao kay naay laing gipamati, pwede traturon i-treat them with dignity, dili singkasingkahan, dili kanang murag ang ilahang gipagawa, iyang katong nagpadayang gipagawas nga kanang yes, ordinary rami citizens, but ayaw mi i-treat nga kanang murag di mi kasabot, ana ba kanang in pain gugaw or inconvenience ka, that's why you're there nya. Tagaan pa kag inana nga attitude. So
that's why like before the hospitality training, no, the manpower also has to be filled. Kay human nature, kung kapoy ka, kung kuwang mo, Waitog mo sipok sa di mo utok. I mean, it's not an excuse because they also
But they're
have
also human beings.
But they're also human beings who can be very tired and be worn down by the system. So that's why we're trying to fill the gap and to make sure that there's no excuse for you.
to lighten the burden ba no?
Yes, and when GovPA met with a new set of nurses and doctors, one of the things she asked was, "Please serve with a smile." Na mo to na that's what she mentioned in the koan. So definitely we will work on that in due time after we feel the fundamental problems.
So, kanang given the many challenges, pero you've also accomplished, and the provincial government also has accomplished so much in the past 2 months now. So, what can the Cebuanos expect for the remaining years, no? At least for the next 3 years lang.
No, I would say no na it's heartfelt. Where we come from is kinasing-kasing journey, and should we make any errors later or lapses or we're not fast enough, understand na we're really doing our best. We really intend to give real service to the Cebuano. So please help us lang, be supportive, and we also call for volunteerism bitaw na you don't have to be a doctor or a nurse or other professionals. If you want to help us, or if it's your birthday and you have extra, you can buy a mask for the hospital. We welcome that.
It's true. Rather than ipalit na to, ay na lang. Smoke ka ni mo, DJ. Bitik yun ba, no? But it's true. Like, especially it's Christmas is coming. Burmonths
already.
Yeah.
So we had the Australian nurse. She's balikbayan. She's vacationing here, but she brought supplies.
Kana siya, Doc. You know what? Naidaghan mga Filipino nurses and doctors who wants to kanang donate or bring supplies here. Pero adto man sad sila tigbason sa customs.
Yeah, so I can't speak much on the methodology of things, and but definitely we welcome any and all sorts of help. So in fact, in February, there's already a group from California who is scheduled to come and also do surgeries. We're excited about that. And then the nurses visiting, the one that just came and brought supplies, we also welcome that. Kaya I think part of them also wants to help fellow Cebuanos.
Yes.
So how will they get in touch with you and your team, Doc? Just in case they want to do more of that.
Yeah, especially the ones overseas.
So there's a nuance. procedure to it, because people often think that the governor's office can just receive donations. We cannot do that. So there has to be a formal letter with an inventory of all these things that you want to submit. It actually has to go to the provincial board.
Okay.
They have to allow us to accept it. So there's a process to it. So dili ka siya naka-fast, but we can work with.
Okay. So sa katong gisulti ni Doc Nikki, no, for Filipinos nga naa sa gawas who want to help our hospitals in the province nga labaw yung nanginahanglan og bisag simple mas may na kay na siya sa tanan. If you plan to kanang naamoy i-donate or naaba mo yung mga equipment kay bogyud ko nga naay mga kanang mga batch ba kanang mga nursing batch nga na sila gawas in
And
ana
they- yeah.
and na sila something nga i-share. I think you just need to message the Facebook page of the provincial capital to find out unsa ang requirements kay government manggod sakto na.
Yeah,
Dili
we
man
have
siya
to be very
something
careful about
Di
that.
man siya something nga kanang dawaton nako namoy ikuan dili kanang kay
There's a process.
ang proper ang sakto na kinahanglan inventory kay basin inigpada na ilaing masudid to nya patay ang kapitulyo.
Lisod na.
Lisod na.
And also, I don't want to limit it to things. So in the 2 weekends ago, there was a group, I think it was a Rotary group, they just did health teaching. They did health teaching. Well, medical consultations, there were about 200 plus. So you really have a captured audience
Yes,
there. And then they were just talking about violence against women. Is this normal? Is this not normal? So it's a beautiful thing. You can contribute in ways na you're comfortable and you have some strength in. So ina lang mi. Ang ayud mo abiba rami ko sa mo makatabang.
Yes, it's true. So kanang murag napangutanan naman siguro tanan nimo DJ, but before that biyaan nato si at before nato siya pabalikon sa Kapitolyo kay na pa siya nagabuhaton dito. Kuando kanang I know grabe ang demands kay dako ang na void nga unsay what kanang mga hitabo nga imong ma-recall in the last 60 days nga nakapakatawa gyud nimo o nakapahilak gyud nimo?
Doghan man. Yes, quite a lot. Dali makiko. When I see before we start the missions and I see all the doctors there, I see the patients there, material jud ko. Kuan jud kayo kanang hi. And then it's more of a place of gratitude bitaw na people are really helping each other, and we really want to see that and to spark that change and to spark that volunteerism in them. Kanang salamat Lord. Mao jud na akong ma-think. And then unsa bay nakapalisod nako unsa to
Mo na to'y nakapahilak
Mako
nimo.
to'y pahilak
Unsa may
nako.
makapakatawa nimo?
Bakatawa. I'm trying to find kanang daghan mag-light moments bitaw, especially when we do these missions. I can't think of one instance, but
Okay, unsay nakapalagot nimo? Unsa may what is it nga murag ano gyud sa imo ba nga nganong nahitabo man nga murag
when we do the ocular visits, and I don't do them by myself. So the PHO, the team goes there, the engineering team also goes with us. So dili na siya arbitrary to
No, one
tuyok
person
lang ha.
only,
Dili,
yes.
it's a whole team with us. I don't curse, but nakabalikas yun. Ano na, pamalikas yun ko pagkitaan ako sa katong one delivery room table bitaw in Barili. Kano man. Kanang naamot ng taani na our people deserve better. So, mula na, dito ko But anyway, past is past. As what GovPams keep saying, past is past. We move forward. Mangita tagpaagi na mapamaayo na and kuan. And we get there.
daghan gyud siguro siya light moments kay di mo siya
Di ko,
makahinumdum.
I'm trying to kuan mga
Yes.
funny moments bitaw in the kani di ay during the missions na ay masuko kay maabot sila magpa-opera ko dok Mag-over ako. But we have to make them understand na these surgeries bitaw, they need to be pre-screened. We have to make sure it's safe.
Okay ra imong blood pressure, okay ra imong sugar. Tingnan kay bisag asa ka inana man gyud.
Na we also want na the outcomes are good and they're safe and kanang it's done at the right time ana. So buto makatawa ko kay mo lagin ko ay maayo pero sige lang ato lang nang ipangingkamutan. Ay one more. Tabi na hinawan. One more was we were working on the t-shirts for the missions and we put all the logos there. Kadawat man kog text. Nasuko ang kuan kay wa daw nimo na apil. I don't know kay wa daw na mo sila na engage wala. But it's such a nice problem to have kinag-ilugay na yun ko times sa ay sa to ipaprint. Kasi ato ni i-add but kana the amount of people who want to help banko it's a good
enthusiasm.
yes so mo ito na pretty good ako katawain ko but it's a good
problem,
thing, yeah.
di ba?
And
Kanang ay kuan sa to ilaha kanang if it's an organization mura tog documentation man gud ang ilahang logo. Sige. So, I think napangutana na namo tanan among pangutana.
affiliate
nimo,
link
Dok.
na lang to my
Yes, affiliate link na lang kay.
Affiliate link na lang
Nangita
to my-
si Doc kay na siya o yan. Na siya. Ang wa ka-get sa mong joke, wa kasugod.
wala kasugod wala you were
Wa
here
kasugod. So, tanawa na lang balik kay amura niyang ibutang ang affiliate link later.
Akong Filipiniana
Yes.
which is very comfortable
Yeah, but we'd like to thank Dr. Catalan for, accepting our invitation and explaining to us where we are and where we're going. I think importante kayo siya nga mapasabot sa katawhan nga something is being done and kanang be patient lang kay di man tauan nga magdungan. And the same time di pud bottomless ang atong resources nga pwede na to palita yon dili man naman tay mga proseso nga sundon kay para dili sad mabulilyaso ang programa. Sa gi-example ni Doc Catalan kanina nga kung naay mission pagpa-screening daan before the mission kung fit ba ka for operation di na sa nila ha kay kinanglan ang number one gyud nato kaning mga naay gihambin nga mga pamati especially kinanglag surgery is safe ka during the operation. Mao gid na ang safety gyud sa mga pasyente. Pero mo na sige lang kay na pa may laing mga mission o maabot. Patience is a virtue. So pero wa ang uban ana. So with that that wraps up this edition of Beyond the Headlines and we hope today's conversation help shed light on the bigger picture behind the story.
And once again, we would like to thank our guest, Dr. Nikki Catalan, for joining us and for helping us connect the dots that matter.
I'm Mildred Galarpe.
I'm DJ Moises.
Good afternoon.
Thank you.